My name is Rebecca Aker, and I'm a registered nurse. A registered nurse can do a lot. I work in the emergency room, so I take care of the patients coming in to register from the emergency room and the patients that come in via ambulance. When the patients first come in, we assess, check vitals. The doctor is right there who can give us orders. We give medicine. Yeah, COVID's changed it a lot. Obviously, we have to wear a lot more PPE, mask, and all that. The volume of patients we see is a lot more, and the severity has been a lot more. There's bed shortages, so it makes it tough. There's nursing shortages, even like supply shortages, so it's a lot different. When I first went to school, I got my associates. I did a couple years at UK where I got my basics, then I went to Moorhead and finished up my associate's degree. And then I worked as a registered nurse with my associate's degree for about 4 years, and then I decided to go back to school. I finished up my bachelor's a couple years ago, and I will be finished with my Nurse Practitioner program in December. A nurse practitioner has a lot more autonomy, so they go in, assess the patient. They're kind of the ones giving the orders, similar to a doctor, even though they are below a doctor. And they can write medications, they can do referrals. They care for a patient very similar to how a doctor does, but they are under a doctor. Yeah, even when I was little, like my mom went back to school to be a nurse when I was 9, and just seeing her do that kind of sparked my interest. You watch the medical shows on TV, and I always wanted to be the one to, help save a life. I wanted to help people. I wanted to be there for people. I just always knew I still don't know what I would do other than be a nurse. It's my passion. I mean, it seems like there is more women in the profession, and here it also seems like most doctors are men, and so there's just still kind of that relationship. But I think it's good, as for women to be a nurse, because we naturally have that kind of motherly, bedside manner, but that's a good thing too. I mean, any men that I've worked with, we're on an equal ground, and it's just a team. Yeah, charting for sure. There's so much of it. I get frustrated because it's almost like, you want to spend more time at the bedside, but you also have to chart too for documentation and all that. And it's even so, when the patient goes to see somebody else, they have that documentation to refer back to. But yeah, I'm not a big fan of charting. Charting's it's literally everything, from what time they check in, vital signs, anything you do, start an IV, give a medication, how the patient changes, now they're alert and now they seem lethargic. Any little thing you have to chart. I love interacting with patients. Of course, I never want anybody, to have hard times, but I love when somebody is having hard times that I have been to school and through the trainings that I know what to do to help them, that I can be by the bedside. I like seeing somebody who does need help, and then I'm able to help them, and then see them through that, and either transfer them. And then later on down the road, when they come back and I see them healthy and happy, that's what I like. Nursing is something that you have to love, that you have to want to do. It is a hard profession. Nurses don't always get treated the best. those who are thinking about doing it, I would definitely get with somebody, kind of shadow somebody, and kind of get your foot in the door. After that, you're really going to get a feel for it, if it's your thing or not. Because even the schooling is so tough, but if it is something that you like, that you're interested in, it's very rewarding.